According to the National Multiple Sclerosis Society, more than 15,000 individuals in the greater D.C., Maryland area are living with MS. This morning, Angela Stribling is joining us from the office of Dr. Heidi Crayton, the medical director of the Multiple Sclerosis Center of Greater Washington in Virginia. Good morning, Angela.
Good morning. I'm here with Dr. Heidi Crayton, who is looking to raise awareness about this devastating disease. She was among the first in the area to offer patients Lemtrada, alemtuzumab 12 milligrams IV, an efficacious infusion therapy for the treatment of relapsing MS when it was FDA approved. Since then, Dr. Crayton has continued to treat her MS patients with this unique treatment option and has seen several success stories from her patients, like Dawn Morgan. Dawn is eager for the opportunity to discuss her personal experience and success with Lemtrada, the importance of finding the right treatment option for your disease, and her message of inspiration for others looking for a new treatment option. Good morning, doctor.
Good morning. It's really nice to be here. Thanks for having me.
Oh, it's great to see you. Now, all right, this is going to sound like a simple question, but just to get it out there, what is MS? And what are some of the most common symptoms?
So MS is an autoimmune condition where the immune system is doing what it's supposed to do. It's just doing it in the wrong place. We don't want our little immune cells to be in the nervous system attacking ourselves. And that's exactly what happens with MS. The fact that there can be destruction anywhere in the brain, anywhere within the spinal cord, means that people can have any of a whole host of symptoms. No two people are the same. No two people even manifest the same symptoms in the same way, which makes it interesting for me as an MS neurologist, but makes it difficult for people who have MS because of the unpredictability and not knowing what to expect next. Common symptoms are fatigue. Sometimes people have visual difficulties. Sometimes people have gait and balance issues or coordination problems, or even sensation problems, maybe numbness or maybe too much sensation like a sunburn or creepy crawly sensations. So there's a whole host of symptoms that people might exhibit depending on where they have damage in the nervous system.
Once you are diagnosed with MS, what kinds of treatments are available?
So there are treatments that decrease the progression of MS, decrease the likelihood of new things happening, scarring in the nervous system, or clinical sorts of events from happening. So that's kind of the MS treatment pathway. Then the other pathway is to put out fires. If somebody has a relapse or an increase in symptoms that last for several days or more, then we usually use steroids to quiet that down. And then really important is symptom management. And sometimes people don't get their symptoms appropriately managed, and that's what people with MS are living with on a day-to-day basis. Their fatigue, their bladder urgency, their spasticity, whatever. Those things need to be tended to as well. But we've come a really long ways in terms of our treatment, and we used to just have injectable, self-injectable products. Then we moved into orals, and we also have infusible therapies, which are really felt to be the creme de la creme, the most effective therapies that we have to treat MS.
Thank you, Dr. Crayton. Such good information, and it's all so promising. Now I want to talk with one of your patients who has a lot to say on the topic, Dawn Morgan. Hi, Dawn. It's great to meet you.
Hello. It's nice to meet you as well.
So tell us about your MS journey.
My MS journey began 18 years ago. I was experiencing symptoms such as numbness, tingling, extreme fatigue, bit of back pain, just didn't feel well at all. I remember telling my family, I don't feel well, something is a little off, so I should be checked out. And that led me to my current physician, my current neurologist.
Once you were diagnosed with MS, how would you say your life changed?
I've had to alter my career and my hours and pretty much where I'm headed for in the future, as well as my time management. I have to ensure that I have enough energy, enough fuel for the day to make sure that everything can get done.
Yeah. And so what treatment options would you say worked best for you?
After taking several disease-modifying therapies, I ended up speaking with Dr. Heidi Crayton, and she suggested Lemtrada, and Lemtrada seemed to be the best option for me at the time. The treatment plan is a 2-year plan, and it gave me my life back. I have a tremendous amount of energy, tremendous amount of stamina. It has really, really changed my focus.
You look good.
Thank you.
It's working. That's amazing. Thank you so much. Continued success. Keep getting stronger.
Thank you.
Thanks for spending time with us. All right, back to you in the studio.